Typically, we would try physiotherapy, a change of lifestyle, modification of activities, and painkillers, simple off-the-shelf painkillers, to see if we can help and manage the symptoms that way before we embark on any more into invasive surgical procedures. That depends on a lot of factors, and that would typically be based on the clinical examination, assessment, effect on the quality of life, and the investigations that we perform. Those investigations are typically X-rays, CT scans, and the MR scans, and sometimes we do an injection into the hip to evaluate the hip. And based on that algorithm, we will come up to a conclusion if hip preservation is a correct option for a particular patient. So hip preservation is successful in 80 to 90% of the patients, which are carefully selected and suitable for this sort of treatment. If obviously hip preservation is not an option, then that would be discussed in the beginning. For the patients who are suitable for hip preservation, it's successful in 80 to 90% of cases. It depends on the type of treatment we embark on. If we are doing keyhole surgery like hip arthroscopy, the recovery is quite quick. You're on crutches for 2 to 3 weeks, and then you need physiotherapy. If, on the other hand, we have to do a osteotomy, which is usually dividing the bone and realigning it, that takes longer time to recover, and you may have to be on crutches for 6 to 8 weeks, depending on how well the recovery happens. And then it would be 3 to 6 months before the patient can do proper physical activities. Well, the most important question really is hip preservation the best option for you? And that depends on the age of the patient, the quality of the cartilage lining the joint, and quality of the cartilage which surrounds the joint, as well as the muscle function. If it is the correct option, then your surgeon will guide you in the correct direction and discuss the treatment options with you.